Alternative practitioners look at the whole picture, the patient's whole being and environment, by using different modalities and treatments to stimulate the body's ability to correct its deficiencies, strengthen the immune system, bringing the body into balance in the least invasive way possible. To practice healing with this intention, an integration of the mind, body, spirit is achieved.
So basically, I ended up being very proud about being a veterinarian. I thought I had worked so hard to become a veterinarian, to save lives, to help animals, to cure illness, and to increase the quality of life.
Because you go into veterinary school and you think, oh, I'm going to be a doctor, I'm going to heal, you know, I'm going to help these animals regain their health, and you want to see that.
And I was floored at the beginning of my career by how many cases we couldn't help. And I was finding more and more that I was being taught by veterinarians there at this practice, which was a very well-known, very good practice in the allopathic sense, that basically antibiotics and steroids was all you could do. If that didn't work, try a surgery. If not, euthanasia was your option. And I couldn't believe it.
So here I go through veterinary school and I'm a veterinarian. All I saw was suffering, and I couldn't relieve it. Not really.
I wasn't getting cures, I wasn't getting healings. You may change the face of the disease, but you weren't changing. You weren't making the animal healthy, and it was dead end after dead end after dead end.
One that sticks in my head was like a cat that had arrested, and I worked really hard and brought it back and got a heartbeat again. And I go to the specialist. Now what do I do? He's like, it's a DoMore. Like it's useless. Don't try anymore. And these were the best of the best people teaching me, and they were just like, give up. And this is somebody's loved pet that, if they only knew.
It's extremely hard to find a cat healthy at 6 years of age. For me to find a 6-year-old cat healthy, that's a treat of the day. They all start having the chronic problems with the teeth and the urinary problems, ear problems, skin problems, tons of problems.
I've seen a huge increase in the number of cancer cases I see, and the age of onset just seems to keep getting younger and younger.
Besides that, I'm seeing animals getting sicker and sicker, much younger. Something I'm really concerned is about that the human beings are getting sicker and sicker themselves, and I think that reflects on their animals.
I've been in practice, allopathic practice, for 38 years, and I realized that something was wrong. The animals weren't getting better. We were suppressing them. They would get better, they'd come back, and they get better, and they come back. Why is it that everybody keeps coming back?
What would be done would be using antibiotics, steroids, many kinds of them, antihistamines, maybe desensitizations, things like that. But they have to be done all the time. The problem returns and it's never cured, and the animal just gets, the disease is driven deeper, the problems are driven deeper into the body. So it's never a cure, it's just managed, and not very well usually.
Every time the body had some kind of a possibility of an infection, there was an antibiotic. The fact that the body had all kinds of white blood cells and antibodies floating around, it didn't mean anything to anybody. They just suppressed that. Symptoms of the language of disease, not the disease. So everybody was giving him antibiotics and shooting the messenger. The body saying, help me. And what is it getting? It's getting drugs. So that the natural ability of the body to heal is very much compromised. Very many of the diseases we were seeing, they were related to the immune system. Well, what were we doing about that? We were destroying the immune systems of the animals with over-vaccination.
Nobody really looked at the big picture of what was going to happen to any individual, human, animal, or otherwise, that was vaccinated too often.
We don't have to do it every year, which there was never any scientific proof. Everyone since 1978 has known that in the profession. And then when you get your practice built around the economics of it, then it becomes not only a judgment call as a scientist and as a doctor, but also as a business person.
And it's amazing to me still that all these clients that come to me that are open for all the alternative ideas haven't even heard that over-vaccination is an issue, and can't even believe that there's an option not to have vaccines every year.
Over time, the most loyal clients who were getting vaccinated every year had the most unhealthy animals. two biggest contributors to ill health in companion animals today was the overuse of vaccinations and the feeding of commercial pet foods.
And the preservatives alter the genetic code so that it affects the gene pool. You have a puppy born, a year later she's been in heat once, she gets bred, she has puppies, her litter, a year later, puppies. In 10 years with puppies, you had 10 generations in 10 years. 10 generations of human beings takes 300 years. And all of the genetic stuff that's out there, that's created by over-vaccination, by lousy food, by drugs, all of those things that are affected by that, you have it condensed, you have it concentrated, and now most dogs that you see come into the animal hospitals, they're genetically compromised.
Well, I had the opportunity to discuss with these breeders breeds that had been living into their late teens, early 20s, were now dying at 10, 11, 12 years of age. And the breeders then began to, ask themselves why this was happening. And eventually, many of them looked at what were the changes that had occurred during the time that they had been breeding their dogs. And one of the biggest things was going from sharing food from the table or the farm, whole foods, to the shift to feeding only kibble dog foods.
I used the analogy. I said, okay, does anyone ever watch National Geographic and you watch the wild animals? So do you see the lion go for the pounce and the prey and they catch him? So now, why do they delete out the part about them taking it over to the barbecue pit? Have you ever figured that out? And then they'll laugh, exactly. And they'll say, see, there is no barbecue pit. I said, they get it raw. And I said, in fact, they get it in the best form of raw.
They lived millions of years on that kind of food, and why would it be now different? We didn't invent the wheel and how to feed the animals just overnight. This commercial food market started, 20 to 30 years ago?
If all you ate was packaged dinners, cornflakes, hamburger helper, you would survive. But how healthy do you really think you would be?
There's a bag of dry food at the supermarket, and there it is, this big yellow bag. And it's got a great big red starburst on it. You know how they do. And it says, meat. And underneath it, a little disclaimer that says flavored, but nobody bothers to read the flavored. Right. They think it's all meat. So these animals are getting this heat processed food, right, where the molecules of the food have been distorted because of the heat processing. The food comes into the animal system. The body doesn't recognize the altered molecule. So what does it do? Up goes the defense mechanism, and out come the antibodies, and before you know it, you've got an allergic response. Right. And that's going on constantly.
So, each generation gets weaker and weaker, and the autoimmune problems get stronger and stronger and stronger, and the cancer rate goes up and up and up. And, when you have 46% of dogs getting cancer, do you remember that? I've been practicing I've been in the veterinary field since I was 10, doing cages. I can never remember the amount of cancer cases that
half the dogs in the United States, as you pointed out, half the dogs that die from cancer. Half the people that call me up about, to have their animals taken care of, have got cancer. And lymphoma, malignant lymphoma is my gosh, it's like an epidemic.
It was very frustrating to see cases that I couldn't really treat very well, that didn't respond well to Western medication, and to only be able to offer options that had potential harm to the patients.
The approach was based on pathology. So you learn how to recognize what unhealthy animals look like, but you're never really taught how to look at health. So that's what I had to learn. I had to realize what were they trying to do? And so then I started looking at what is healing. I had to learn that, like inflammation. Inflammation is the first step in healing. So what do? We come up with anti-inflammatories. So we work on how to get rid of the symptom. That's reductionism. That's what we're taught. So I had to rethink that. Really, which wasn't very hard for me because I was already brought up that a fever's good, Fasting's good, diarrhea's good, vomiting's good.
In 2004, at the age of 55, I started studying acupuncture, and it completely revitalized my career. I went on to study Chinese herbs, then I got interested in homotoxicology, and it's a never-ending process. Once you start studying alternative therapy, you never stop.
Well, I think, coming into the alternative modalities, you start to really question what health is about. Trained as a conventional veterinarian, like we all are, we have to go through it all the same way. I think we never were really taught what good health was.
Veterinary medicine, the way it's taught, the way it's practiced, the way it's become commercialized and corporatized, lacks a soul. It's divorced itself from the real content that I think so many of us go into veterinary medicine for, which is to have that connection, that heart connection with the animal. And the aspect of alternative medicine that speaks to prevention is, I think, really important. If you can nip the problem in the bud before it occurs, if you can educate the public, then that's the best remedy of all for chronic disease.
I feel like I understand medicine much better now than I did before. Conventional medicine is a lot about treating symptoms, and alternative therapy is more about enabling the body to heal itself. So I've gone from feeling like a doctor to feeling more like a healer.
I find that Chinese medicine tends to go a lot deeper and tends to treat the being, the essence of the animal, and not just that one area that may be hurting at the time.
So the power of your hands and in developing that power, taking that special touch and learning how to channel the energy within yourself, and then the energy from out there, the universal energy, through your hands into your animal, is very powerful. And it's something that takes time to develop. You have to be patient with it, but it should not be overlooked.
I have a lot more respect for the energetics, the spiritual aspect, the intent, some of the intangibles.
It's exciting, it's never boring, it's difficult. Holistic medicine is difficult, it's never fast, it takes a lot of time to figure out the treatment. It's never routine treatment since it is tailored to the patient, but that's what makes it interesting.
But I had to go against my training.
I really believed what Hippocrates said was leave your crucibles on the shelf. And I always believed that less was best, and so that's the way I transitioned. I charged more for my office exam, and I didn't make them buy vaccinations.
Plus, I told them I wouldn't see them. So it was, do you want to go keep seeing me or not? And I didn't know what was going to happen. I thought maybe I was going to be out of business. And I lost a few people, but not very many. I mean, I got more. More people started coming because they wanted to meet this veterinarian who thought pesticides were dangerous.
You cannot use so many drugs, so many side effects, but Chinese medicine play big rules.
When we prep an animal for surgery, we use acupuncture needles as part of our pre-anesthetic protocol, and we have found that we need less anesthetic medicine. I've also found that the recovery is much smoother, so we've begun to integrate pre and post acupuncture into orthopedic procedures, and we need to be hand in hand showing how acupuncture works, how herbs work, how massage works.
So best medicine, I think, is integrated medicines where everybody works together the best for the animals.
Everything that we do homeopathically has to rely on an animal that has a good nutritional base, and because the vital energy will not work if the nutrition is not being supported.
It seemed that whenever I started feeding my dogs some raw food in their diet, their coat became more shiny. They seemed to be more vibrant as far as their color. They just seemed to be a lot more red. And they didn't smell anymore. I don't have to bathe them, which is the most exciting thing about it.
I was changing the diet for a month, and then asking the client to come months later, see what was left, and then treat the animal at that time. And you will not believe the change that can happen just by nutrition. It's flabbergasting.
So I'm saying this historically, if you go back and read how medicine over the centuries, how it has evolved, historically this has happened before. it comes to a point where the system isn't working very well, and then other systems spring up, and it changes, and now we do something else. And I think that's probably coming.
My dream is that before I die, that alternative medicine will not be 11-hour medicine. So I believe that since economics pretty much in our culture drives everything, that it'll come from the general public rather than from the profession itself.
There's a bigger picture here of the health and well-being of humanity and of society, and a lot of people who are in this work feel that the use of allopathic drugs and so forth, well-intentioned and scientifically based as all that is, that the effect of a lot of that, because it ignores more the vitalist aspect of human beings, that it has caused a suppression of healthy dynamics that is playing out in society. And I feel a little bit at times like tilting the windmill. It's like there's such a huge behemoth of energy going in the direction of a lot of things, but of allopathic medicine and of fragmentation in general in our society, different disagreements of religious beliefs and political beliefs. And at the same time, there is an undercurrent of wholeness and of hope that's coming from people, of which I feel that this is just one small current, that it's something that's bigger than all of us. And you asked me what my hope was, and my hope is really that unfolds, and that the world becomes a much more harmonious place.
Good boy.